Welcome to our presentation of the educational video about the kidney and the renal replacement procedures. First of all, let's take a quick look at the topics we want to start with in this video and what we still want to deal with on our journey in this learning video. This can be explained using a simple roadmap. Let's start by explaining a little about the basics of the kidney. We will then introduce you to the functions of the kidney before moving on to the pathologies of the kidney. At the end, you will receive an overview of the renal replacement therapies used and standards for ensuring the functionality of renal replacement therapies. Let's get started right away. First of all, let's take a look at where the kidney is located. The kidney is a retroperitoneal organ. The kidney lies at the level of the thoracic vertebra T12 and extends to the lumbar vertebra L2 to 3. The kidneys lie below the diaphragm. The right kidney is surrounded by the liver, the left kidney by the spleen. Both kidneys are naturally surrounded by the other kidney. The picture on the left shows the position of the kidney from the front. The picture on the right shows the position of the kidney when we look at the human body from behind. It is easy to see that the kidneys lie far back in the body and that the right kidney lies lower than the left due to the liver. Let's start with the basic structure of the kidney. The kidney is a bean-shaped approx 10 to 12 centimeters in size and weighs 150 grams. The kidney consists of 3 layers. On the very outside is the renal cortex. It contains the most important functional unit of the kidney, the nephrons. The middle layer of the kidney is called the medulla. It contains the renal pyramids. The renal pelvis is located in the innermost part. It collects the urine from the nephrons and passes it on to the urinary system via the renal sinus. Let's take a closer look at the most important function unit of the kidney. The nephron consists of the renal corpuscle and the tubular apparatus. The renal corpus consists of the glomerulus and Bowman capsule. The Bowman capsule is a double-walled epithelial envelope that surrounds and protects the glomerulus. The glomerulus itself is on the inside. It is a tangle of blood capillaries. The glomerulus is where the primary urine is produced, which is then passed on the tubular system. As the primary urine contains many important substances that are still useful for the body, it undergoes a process of reabsorption. Example, the absorption of important substances that the body can still use into the blood. This takes place in the tubular apparatus. In the first section, the proximal tubule, the primary urine is further concentrated and prepared for reabsorption. Glucose, calcium, and amino acids in particular are reabsorbed here. Secondary urine is formed in the intermediate tubule. Reabsorption removes substances important to the body, such as water, sodium, magnesium, and chloride from primary urine. This is further intensified in the distal tubule. Finally, the secondary urine contains only urinary substances, in example organic and inorganic substances that the body no longer needs, such as creatinine or urea. The secondary urine, which is now referred to as urine, collects in the collecting tube and can be passed onto the urinary system for extraction. We would now like to introduce you to the hormone production of the kidney. First, the aldosterone. Aldosterone is a mineral occluded hormone. It affects the nephron by increasing the absorption of the water and sodium and increasing the extraction of potassium. It thus maintains blood pressure and electrolyte balance. Renin is an enzyme. It is a key component of the RAAS cascade and helps to regulate blood volume and maintain the acid-base balance. Cortisol is a glucocorticoid. It increases blood sugar via gluconeogenesis during stress. It also helps to regulate fat, protein, and carbonate metabolism. Calcitriol is the active form of vitamin D. It promotes the absorption of calcium and phosphate in the intestinate and supports bone mineralization. The glucoprotein hormone erythropoietin increases the production of red blood cells in the bone marrow. This happens, for example, when we are at high altitudes. Adrenaline is a catecholamine hormone. This well-known hormone accelerates the heart rate, expanding the bronchial tubes, and is mainly used in stress or dangerous situations. Norepinephrine is a hormone and neurotransmitter that has a similar effect to adrenaline, only stronger. It increases blood pressure and has a vasoconstrictive effect and is used, for example, to treat shock. On this slide, we show you in which layers the respective hormones are produced in the kidney. Glucocorticoids are synthesized in the cortex and catecholamines and peptides in the medulla. Mineralocorticoids are produced in the zona glomerulosa. Adrenogens are produced in the zona reticularis. It is also important to understand how the water balance of our human body is made up. The human body consists of around 60% water. This is slightly less in women. Intracellular water, an example the water inside our cells, accounts for 66% of this water. Extracellular water accounts for 34% of the water balance. If we take a closer look at extracellular water, 80% of this water is accounted for by interstitial water and 20% by blood plasma. This is influenced by physical activities such as sweating and extraction of water via the stool and urine. The human body must therefore absorb its water requirement of 2 to 2.5 liters per day through drinking, food, and oxidation water. If we take a close look at water balance of the human body, we see that most of the water is accounted for by organs such as the eyes, brain, and blood, and very little by fat. For this reason, patients with pronounced obesity can have a body water content of dangerous 33%. But what transport mechanisms does our body have? We have convection, diffusion, and osmosis. Let's talk about convection first. To help us understanding convection, we have brought them a picture of small experiment. You can see glass tubes containing water that has been made visible by adding ink. A burner is now used to heat the bottom right hand end of the glass tube. This creates an area of high pressure. At the upper end, where the opening is located, there is an area of low pressure. Convection always requires a driving force. This driving force is a pressure difference. Due to the pressure difference, the water is now transported. In the body, this pressure difference is generated from the blood flow from the heart and for the air we breathe in and out. Convection, therefore, describes the transportation of substances through a flowing medium. Diffusion refers to the process based on Brownian motion of equalizing a difference in concentrations of a sufficiently mobile substance that is distributed in an otherwise homogeneous area of space or material. Diffusion works with small molecules. The picture shows a special form of diffusion, selective diffusion. Selective diffusion is a special case of diffusion in which the solvents between which the mass transfer takes place are separated by a semi-permeable membrane. This means that the concentration can only be equalized by the particles that can pass through the membrane. This is also the case in dialysis technologies in the human body. For last, the osmosis. If there is a semi-permeable membrane between two compartments that allows the solvents to pass, but not the solute, selective diffusion results in a directional flow of the solvent. This moves in the direction of the concentration gradient of the solute until the concentration equilibrium is reached. An example, the solvent molecules move from the side of the membrane with lower concentration of the solute to the side with the higher concentration of the solute. The osmotic pressure is now the pressure that exists on one side of such a membrane, which is only semi-permeable to the solvent, caused by the solvent particles diffused into the compartment on this side and the particles already present there, which is exert pressure on the compartment wall. The portion of this pressure caused by colloidal particle is referred to as colloidal osmotic pressure or oncotic pressure. The most important mechanism for the exchange of fluids at interstitium is filtration. Filtration, first discovered by Ernst Starling in 1968, filtration describes the exchange of fluids in the capillaries due to the hydrostatic capillary pressure and the colloidal osmotic pressure of the blood plasma. The hydrostatic capillary pressure determines the exchange of fluids from the capillaries into the extravascular compartment and the COP intravascular compartment. The figure shows the schematic structure of the fluid exchange in the capillaries. If the hydrostatic pressure now rises above the colloidal osmotic pressure, secretion takes place. If the colloidal osmotic pressure now rises above the hydrostatic pressure, resorption takes place. If the filtration pressure drops to zero, filtration comes to a standstill. This is referred to as filtration equilibrium. This image shows the body reacts when your blood pressure is too low or when there isn't enough water or salt in your body. It starts with the kidneys, which notice the problem and release a substance called renin into the blood. Renin, that reacts with protein from the liver called angiotensinogen to form angiotensin 1. As this moves through the lungs, it changes by an enzyme called ACE into angiotensin 2, which has two main jobs. It narrows your blood vessels to raise your blood pressure, and it tells the adrenaline glands to release a hormone called aldosterone. Aldosterone then tells the kidneys to keep more salt and water in the body instead of getting rid of it through urine. This increases the amount of fluid in your blood, which helps raise your blood pressure back to normal. In simple terms, this system helps the body stay balanced by adjusting how much water and salt we keep or lose, especially important when you are dehydrated or have low blood pressure. This table shows how two important hormones help our body control water balance and blood pressure. First, we have ADH, which stands for antidiuretic hormone. ADH is released from the pituitary gland when the body is dehydrated or when there's too much salt in the blood. It tells the kidneys to keep more water by adding special water channels called aquaporins. This reduces the amount of water we lose in urine, so urine becomes more concentrated. As a result, urine output decreases and blood volume pressure go up. Next, there's an NAP, or atrial natriuretic peptide. This hormone is released by the heart when blood volume or pressure is too high. It tells the kidney to get rid of more salt and water. That means less is reabsorbed in the body, urine output increases, and blood pressure and volume decreases. In short, ADH saves water when don't have enough, and NAP removes extra water when we have too much, keeping the body in balance. Now, important functions of the kidney are filtration of blood, production of urine, reabsorption and resorption of vital substances, excretion of urinary substances, hormone production. Maintaining the acid-base balance. Convection is the transport of particles by flow, example blood flow. Osmosis is the diffusion of a solvent along a concentration gradient. Diffusion is particle transport along concentration gradient from higher to lower concentration. The RAAS cascade plays an important role in the regulation of blood pressure and the salt-water balance by renin, angiotensin, and aldosterone. Now that we know the most important functions of the kidney, let's take a look at which functions we can and cannot replace. In principle, it is possible to replace filtration, reabsorption, and resorption with modern dialysis systems. Unfortunately, it is not possible to artificially reproduce the regulation of hormone balance and production of hormones. What can damage the kidney so that the patient has the induction to undergo dialysis therapy? A distinction is made between acute and chronic renal insufficiency. Acute renal insufficiency occurs when there are sudden structural changes in the kidney. This can happen, for example, when certain drugs are administered during resuscitation. Damage to the kidney occurs within a few hours. In the case of chronic renal insufficiency, failure only occurs after months to years. Slow change and functional impairment of the kidney occur due to diseases such as diabetes, tumors, a cystic kidney, or heart failure. In principle, a patient with a glomerular filtration rate, this is a value that indicates how well the kidney can still filter the blood, of less than 50 milliliters per minute, is considered to be in need of dialysis. We want to look now at two most important and most frequently used dialysis methods with you. These are hemodialysis, you see in the picture, and peritonealysis. First, we ask ourselves the question, which substances are filtered out of the blood? First, waste products. Nitrogen-containing waste products accumulate in patients with renal failure and are absorbed during hemodialysis by diffusion through the kidneys, effectively removed by the semipermeable membrane of the dialyzer. The substances are urea, creatinine, and uric acid. Second, excess electrolytes. That can be potassium, phosphate, sometimes sodium and calcium, depending on blood levels and composition of the dialysate. Third, the excess water. Hemodialysis removes excess water through ultrafiltration and certain toxins or medications. We know now which substances are filtrated out of the blood, but do substances also get back into the blood? Yes, easy that would be. First, electrolytes from dialysate. If a patient has low levels of sodium, calcium, or bicarbonate levels in the blood, these can be presented in higher concentrations in the dialysate and diffused into the blood. Second, heparin, administered to prevent blood clotting into the dialysis circuit. And third, possible contaminations, but this is extremely rare with modern standards. Let's take a closer look at the process. In hemodialysis, the blood is pumped out via a shunt axis. This is a vascular axis on the arm, using a pump. The blood first passes through an arterial pressure gauge. The arterial blood pressure is measured here. A blood thinner called heparin is then administered to the blood. This is very necessary to prevent the blood from the clotting in the dialysis machine. After the blood flow measurement, the blood goes through the actually dialysis process in the dialyzer. Inside the dialyzer, we have a semipermeable membrane. A large number of hollow fiber membranes as semipermeable membranes run through the dialyzer. The blood flows through the hollow fiber membranes. The dialysis fluid flows past the outside of the hollow fibers membranes against the direction of the blood flow. This is called the countercurrent principle and increases the efficiency of the dialyzer filtration. The exchange of substances takes place in the dialyzer by molecules passing through the membrane by means of selective diffusion, blood cells and proteins. The transport of substances across the membrane depends on the concentration gradient. Dialysis fluid is fresh solution that is added to the dialyzer and has not yet undergone molecular exchange. Dialysate is the solution that comes out of the dialyzer and has undergone molecular exchange. It now contains urinary substances. The materials used for hollow fiber membranes are often synthetic polymer membranes such as polysulfone, polyethersulfone, polyacrylonitrile, and polyamide blends. After the dialysis, the perfect blood is returned to the patient's veins via the dialysis machine tubes, which are usually made of silicone via a venous pressure measurement system and air trap that can detect air bubbles and switch off the machine in an emergency and fast back into the patient's body. The dialysis solution that is usually basically consists of sodium, potassium, calcium, magnesium, glucose, and bicarbonate. Now the peritoneal dialysis. In peritoneal dialysis, the peritoneum is used as a dialysis membrane. The peritoneum contains capillaries, venules, and lymphatic vessels. Dialysis takes place in the body during peritoneal dialysis. The peritoneum acts as a semipermeable membrane in peritoneal dialysis. During peritoneal dialysis, a sterile dialysis solution is introduced into the abdominal cavity. This solution acts as a dialysis fluid. According to physico-chemical principles like concentration gradient, molecular size, electrical charge, dialysable substances migrate from the blood vessels of the peritoneum into the dialysis fluid in the abdominal cavity or vice versa. This takes place until the concentration gradient is equalized. This mainly occurs through diffusive substance transport. Larger molecules are also transported convectively. The effectiveness of the procedure depends largely on the amount of peritoneal dialysis through introduction and its retention time in the peritoneal cavity. Fluid removal can be achieved in peritoneal dialysis by adding osmotically active substances to the peritoneal dialysis solution. Glucose is mainly used here. As the effectiveness of peritoneal dialysis depends on the morphology and changes in the peritoneum, the patient must always perform a PET test, the peritoneal equilibrium test. before each treatment to determine the permeability of the peritoneum and thus the effectiveness of the treatment. So the PET serves to assess the peritoneal transport situation, evaluates whether the PD is possible, an example how good the permeability of the peritoneum still is, and determines the choice of filling volume from 1 to 0.5 liter to 2.5 liter. An adapter specific to the bag system used is connected to the extraperitoneal end of the PD catheter. The catheter, adapter, and transfer system are worn permanently in or on the body. The adapter is inserted into the end of the catheter and secured with union nut. The picture shows the adapter itself is made of titanium or plastic and has a Luer lock screw connection on the tube side. The transfer system is a tube with a locking clamp and a tube connector. The transfer system is closed during the dwell time of the PD solution in the abdomen. The transfer system must be changed at regular intervals. Under normal circumstances, the PD solution remains connected to the catheter. The enema bag is rolled up and hidden under clothing. At the end of the retention time, the bag is unrolled and used as an outlet bag. A new enema bag is then attached. Only when the CAPD bag is connected to the transfer system can an infection occur if the charge is not sterile, as the germs are flushed into the abdominal cavity via the connector and the transfer system. The automatic peritoneal dialysis is a peritoneal dialysis machine called a cycler is used here. The data required for the treatment is entered into the cycler manually or via a chip card. Total dialysis exchange volume, abdominal fill volume, duration of treatment, and tidal volume. The machine then calculates the number of exchange cycles and ensures that the solution is heated and the dialysis inflow-outflow is controlled by means of valve mechanism. The tubing system is manually connected to the bag system and the tubing cascade, which various valves is inserted into the cycler. The patient connects to the device in the evening. If there are any failures during treatment, the device issues an alarm. The ultrafiltration volume is then saved and can also be read out via chip in the PD center along with all other data. And the PD can be carried out at home. Now at last the standards to help protect patients and ensure dialysis treatments work the way they should. First, the ISO 6061 series makes sure that medical devices like dialysis machines are electro-safe and work properly even if something goes wrong. Next, the ISO 23500 series checks the quality of fluid used in hemodialysis like water and dialysis. Since these go into the body, they must be very pure. The ISO 8637 series covers parts like dialysis and blood tubing. It ensures these work well and are safe to use with blood. ISO 10993 is about material safety. It tests if the parts that touch the patient, like membranes or tubing, are safe for the body. ISO 1167 is for packaging. It makes sure that the single-use parts stay sterile until they are used. Finally, we have sterilization standards ISO 11135, 17665, and ISO 11137. They make sure dialysis products are properly sterilized and safe to use it. Let us summarize now. It gives two main processes, the hemodialysis and the peritoneal dialysis. The hemodialysis filtering the blood outside the body using a capillary dialyzer. The peritoneal dialysis filtering the blood within the abdominal cavity using the peritoneum as a dialysis membrane. Testing of dialysis machines and components in accordance with the relevant standards. And now we would like to thank you for your attention and hope that our educational video has given you an understanding of the exciting topic of kidneys and renal replacement procedures. Below now you will find literature sources and an overview of our contributors. We wish you all the best, your Department 9.